The town of Largo received its name in 1886 so that the Orange Belt Railroad could build a station. Largo was also known as the Citrus City for its rich farmlands and central locations, which allowed Largo to be the place where citrus was shipped to the north. The population in Largo area grew substantially in the 1950s as World War II veterans returned, ranging from 1,500 residents to more than 5,300 residents. The population also exploded to over 22,000 residents by 1970 when developers bought groves that were hit by a freeze in 1962 to build homes for the growing city. And Largo continues to grow, and it is also now the fourth largest city in the Tampa Bay area. Largo has many different housing options available, from the single-family homes, apartments, mobile homes, townhomes. There are also government housing available for low-income families in the community. One that is located in West Largo is known as Rainbow Village. It is made up of multi-duplexes, triplexes, and has its own community center on site and fire station within the neighborhood. There are also lots of different places of worship within the community that offers many different programs for the people that in the community, ranging from children to senior citizens. There are many different forms of public transportation, such as the PTSA bus system, taxis, also volunteer provided transportations such as Care Ride, and they all have different prices that they range from. Also, some availability of health related items. Access to food is rather easy. A recent search resulted in finding about 650 different places to purchase food and medication. 281 of those results were found to have different drugstores, and these are just some different places within the community.
Residential streets. You also have taxi cab services. There's also the newest thing, which is Uber, which you can actually order a cab and order the person to come and get you from your phone and handle everything that way and pay for it as well. The available health-related items, we have food. A quick online search showed 650 results for places to purchase food and medications, including small privately owned markets, local produce stands, and some corporate stores such as Publix, Walmart, and CVS. This doesn't even include the local gas stations, churches that I mentioned, charities, and the food banks. Also narrowing the above search, I found 281 results for drugstores throughout the city of Largo, and we have two hospitals that the names are Largo Medical Center, Largo Medical Center of Indian Rocks campus, and we also have a diagnostic clinic, which would be considered one of your one-stop shops for medical services, from labs, seeing the doctor, to having x-rays done.
Analysis of the population of the community. There are 2 points here that are going to be covered. First, a population issue, and then health concern for Largo. As for the population issue, is that it was noticed that 7% of the population in Largo are Hispanic and Latinos, and among these Hispanic and Latinos are immigrants. And immigrants are more vulnerable, and they are more prone to living in precarious homes, as well as lack the resources. For the second point, the health concern for Largo, that would be lack of inactivity. And lack of physical activity is the fourth leading cause of death worldwide. In Largo, they have many parks and activities for all ages. There's also discounted rates for residents with a low income. Parks provide an opportunity for adults and children to be more active. Activity, along with nutrition, can prevent obesity among children and adults. Analysis of adequacy of health-related resources and availability. The access in Largo is very good. Largo has many community health services such as free clinics, diagnostic clinics, 2 hospitals, many primary health care providers, and specialists. There are many forms of transportation in Largo. Acceptability. Based on the research, Largo has the capacity to provide many resources for its residents. Affordability. There is something for everyone. Largo is an urban city that has been able to evolve with its population. Largo has many churches that can help with bills. There are also sliding scales to help with payments. There is programs available for children and family to help with health care if needed. Largo has many resources to help with affordable health care. As for the Healthy People 2020, the top 3 objectives of Largo based on the top communicable diseases and the leading causes of death in Largo are as followed. 1. Sexually transmitted diseases. 2. Heart disease, and stroke. And number 3, cancer. So for the sexually transmitted diseases, screening should be available. According to the U.S. Preventative Service Task Force, adequate evidence has found that screening reduces the complication of chlamydia and helps to treat gonorrhea by reducing infections. Second on the list is heart disease and stroke. 1 in 3 adults live with 1 or more cardiovascular disease. Some disparities found in Largo, but not limited to, are socioeconomic, prevalence of risk factors such as gender, age, race. A great way to prevent heart disease in the future is starting with the children. Strong evidence shows that reducing the time that a child spends sedentary in front of a screen and increasing physical activity will help prevent obesity among children 13 and younger. Third on the list is cancer. Screening is important, as well as follow-ups when needed, and proper referrals to treat the cancer.
The City of Largo provides an adequate amount of environmental resources and programs to their community that contributes to environmental sustainability. The City of Largo's Mixed Recycling campaign earned them the 2015 Solid Waste Association of North America's Gold Excellence Award in 2015 for their mixed recycling program. In their first year, they recycled 6,800 tons and saved the city approximately $250,000 in disposable fees. The city also offers reclaimed water to their residents and local businesses, which provides an alternate water source. The production of reclaimed water meets all state requirements for the use of the water to irrigate parks, playgrounds, schools, and golf courses. Although reclaimed water is not offered throughout the entire community, for those who do use it, they are able to save money and contribute to a healthier environment. Approximately 12 million gallons of residential and commercial wastewater is treated and processed daily at a wastewater reclamation facility in Pinellas County. This facility operates 365 days per year and is monitored by the State of Florida's Department of Environmental Protection. The City of Largo also monitors the air quality. They've created a link on their website which allows anyone to access and monitor the air quality in the area. This system will tell the viewer how polluted or clean the outdoor air is and what associated health risks may be of a concern to the viewer. The current air quality is listed as good without any health concerns for its citizens. The City of Largo hosts several community meetings to assist city leaders to better understand the type of city residents want to live in. Each 90-minute conversation consists of a city representative facilitator meeting with any of the residents and allowing them to share their thoughts and aspirations on how to shape the city's future. These meetings are held throughout the community, and the next meeting will be held on February 26th at noon at the Largo Library. The city also offers several different affiliate boards and committees that may provide guidance, financial, or volunteer support to various organizations within the city of Largo. Commission meetings and agendas are held the first and third Tuesday of the month at 6 p.m. at the city's commission chambers at Largo City Hall. These meetings are open to the public. The last meeting was held February 16th, which consisted of a consent docket, which included previously budgeted or administrative matters. This included purchasing various items for the community, which included police ballistic vests, which cost the city $17,500. It also included public hearings, legislative matters, and staff reports. The fiscal year 2016 budget is $147,687,500, which is an increase of 6.97% from 2015. While assessing the community, we observed these issues as the top 6 highest priorities that need to be addressed. Number 1, texting and driving. Criminal reckless driving is 15 cases. Non-criminal cases are 10,035. Helmet safety, 19 cases. Seatbelt violation, 1362. Pedestrian safety, which includes bicycle pedestrian, is 897. Child restraints, 48. And obesity. The prevalence is greater than 20% in the United States, and these statistics are from 2014. The risk of injury when taking your eyes off of the road to write and text or read the screen surpasses the risks of driving while intoxicated. The single most unsafe risk to the texting craze is the prospective loss of ability to focus on a single task. Overall, the study found that an increased proportion of U.S. drivers chatted on the phone, read or sent emails or texts while driving than drivers in various European countries. Many countries outside of the U.S. have completely banned the use of handheld cell phone devices while driving. However, the use of hands-free devices are permitted. The Pinellas County Sheriff's Office offers classes to teens that will prepare them on how to control dangerous situations while driving. The next program will be offered on March 4th and 5th. There are 3 main areas of inattention: not having your eyes continuously on the road, not having both hands on the wheel, and not focusing while driving. As a community health nurse, we can educate drivers on the importance of not texting while driving in order to save lives.